90% of the things that we do to be 100% sure on your test day will be easy because of your preparation was right. Your preparation was on point, right?
Okay. I have a question. You said I should pick a name. I picked a name, and then you said I should go to my phone. What do I do on my phone?
Once you get started, you will see the question. So you just pick A, B, C, or D. So
am I gonna sign in again on my phone because it's just making noise?
Okay, do you see your name on the screen?
This screen on the my laptop, I see my name.
Okay, so just wait because we haven't started the game.
Oh, I thought you said the phone. We should use the phone to answer the question.
Right, but you don't see a question yet.
But am I going to use my laptop that I'm signing, or I'm going to use my phone?
Oh, you're going to use your phone. The laptop is just so that once we're done with the game, the laptop is because you can see the questions bigger on the laptop and we can talk at the same time. But
I think she's asking if she has to log in on her phone, and yes, she does through the link that you sent.
Correct. So you log in on your phone to play the Kahoot game. You log in on a Google Meet so we can talk.
I just typed in Kahoot.it on my phone and then use the code.
That works as well.
Yeah, just do that.
Yeah. No, she's in.
Yeah. What you said?
Kahoot.it.
Man, you're already in. You're already in. You see your name. Right?
Yeah, I see my name, but I just wanted to wait to answer the question. That's why.
Right. So when the question pops up, you'll be able to answer.
Oh, it says I should enter a code. So that's where I'm going to enter the code 618. Okay.
Okay. All right. So is there any questions before we get started today? I know there was a
Dr. Lopez, I have a quick question.
Go ahead.
Yeah, it's just real quick. On the Friday classes that you offer, are they recorded?
Yes and no. So it is the same content of the recorded classes. But if you go to module 10, I have recorded previous live classes. So yes. But I can't record every week, otherwise the course will be years to finish. So I have recorded one live section of the same topic, and I uploaded to your module 10 of the course.
Okay. Thank you.
Yes. Okay. All right, guys, let's get started. Again, you answer the question on your phone or device that you are connected to Kahoot. Good luck, everyone. 1 minute per question. Let's do this. All right, perfect. Well done. Very proud of you guys. Check this out. The question, it's about a 16 years old. What we learned yesterday. For the test, look at the age. match the age to your dumping sheet, because you have written down in your dumping sheet, Erikson, right? I hope you do, because you don't want to be at question number 175 and be thinking, which one is it? You can quickly look at it and figure it out. So look at the age. It should lead to identity versus role confusion, right? So we know that is just about 12 to 20 years old. That's it, most likely, right? Then if you really want to confirm, look at what the question says, right? In here, it matches the description as with identity confusion to the answer. So that would be a super easy question, okay? So good luck. Let's move on to the next question.
I don't see what I'm doing. Yes.
All right. But before we answer this, Aaron, ask your question, please.
See. Hi, Dr. Lopez. I can't get to touch and pick what I want.
What do you mean?
I'm not able to pick the answers that I want to pick on my phone or on the laptop.
Okay. Are you logged in? Do you see your nickname?
I didn't see mine either. So
I'm sorry?
no, I didn't even see mine. So I'm just gonna pick on the computer on the laptop.
You can't pick on the laptop because it's not going to record unless if you're playing. But you can still stay and watch. Okay. So you can go to www.kahoot.it, not .com, IT.
Okay.
Create a nickname
Okay.
and then enter the PIN code 618-7102. This information is at the bottom of the page here.
Okay.
Okay.
All right. Thank you.
Right. Absolutely. So yesterday we covered existential crisis, right? The core of it is, what's the purpose of my life? Right? Why do I exist? And this question was fairly easy because it matched what the answer said, right? The meaning in the exploring of one's life's choice. Who is this good for? For those with depression, suicidality, even anxiety, right? Anyone who's questioning, should I stay alive or should I hurt myself? What's the purpose of life? It's a great question, especially for those on terminal illness, where they take the time to reflect on their lives and they are going through some crisis. It can be a good option for psychotherapy for those folks as well. Okay, so it's all about the meaning of life and choices made and how they
Can
want
we
to.
use it? Can we
Go ahead.
use it on? Can we use it on by borderline personality disorders?
Not really. I mean, for borderline personality disorder, you can do CBT, but the ideal is really is dialectical therapy, dialectical behavior therapy, right? Because dialectical behavior therapy is structured. They need very firm boundaries, structure. Can you put 10 of them in a room and let them do and be free and ask questions anytime they want, they will absolutely break their room apart, right? So dialectical behavior therapy is very high yield for the test and is very effective as well for borderline personality disorder. Okay. All right. Next question. Thank you for asking there. So you see the age, you should know what this is. Sorry. Oh yeah. It's the Erikson question. Look at the age, match the description. We have 20 seconds left. Okay, everyone answered. Well done. Thank you. Everyone got it correct. So integrity versus despair, 65 and older. Then we have trust versus mistrust, 0 to 1 there. Then we have autonomy versus shame, right? 1 to 3. And then we have initiative versus guilt as the last one in this options, 3 to 6, right? So if you take the time to memorize Erikson, these questions has been easy on Erikson. Cannot promise you on the test will be easy. Take the time to memorize the table that we learned yesterday. Take the time to memorize the age, how we showed you yesterday. It will pay dividends. You could easily get 5 questions on Erikson. So it's a little bit cumbersome, or there are 8 stages there. But if you take your time, it could be up to 5 to 7 questions on Erikson. Okay? So get those 7 questions correct. Okay, well done, guys. Well done. Yesterday we covered Piaget in detail. It shows today. You guys are killing it, right? So sensory modem, we cover how bipolar patients oftentimes they have difficulty mastering sensory modem stage. But wait a minute, they are older than 18 if it's a bipolar. How come sensory modem usually 0 to 2, right? Years old, they have a master. Piaget does not go by age, go by mastering their stages. And we covered why bipolar patients often, not bipolar, borderline personality patients often have difficulty with abandonment. Okay? So please take a look on those 4 stages there. If you ever have questions, let us know. We also cover how people get confused with concrete versus formal. If you want to remember, just see the C for concrete is before the F in the alphabet, so you remember which one is which. Okay, perfect. You guys are doing super well. We talked about Fyodor stages of development yesterday, five of them, right? The oral stage is that where the baby find pleasure at that age, right? Just about 2 years old. It is characterized by the child's primary zone of pleasure and explorations being the mouth. Please don't forget about the phallic stage. Why the phallic stage is so high yield, right? Tem que ver Kahoot. Daqui, deixa eu tirar foto. Tá, tá. Tira a foto aí.
Well, it's B.
Okay, one quick second, guys.
B.
Let's take a look on this. Okay. All right, CBT targets maladaptive thoughts, patterns, and behaviors to reduce anxiety. Anybody disagree? Who covers the unconscious mind that much of our problems today is the result of what we are unaware of at the back burner of our brain? Who's the theorist that says
Sigmund Freud.
Freud, right? This is
Mhm.
Freud 101. We covered this in detail yesterday, right? So this is Freud. We also cover about CBT. What did we say about CBT? What are two things that are very high yield for the board? What do we have? What we ask patients to do?
Journal.
Journaling, right? Very high yield for CBT. What else do we say? That the goal is to cognitive restructuring, right? Now, CBT, what's the gold standard for OCD? What's the therapy that would be a gold standard? CBT is a good choice as well, right? CBT works for almost everything.
Exposure.
Yeah, therapy. But exposure therapy is a good for CBT as well. But exposure therapy is very good also for trauma, right? We give an example of a spider, car accidents. Exposure therapy is very good for that as well. Okay. GAD, CBT is good for that. Okay. Okay, exposure therapy, right? All right. Good job, everyone there. PMHNP 25, Sarah, good, CK, and Natalie. Well done. Exposure therapy is a CBT technique commonly used to treat anxiety disorder, including panic disorder. So this is what I want to talk about. What's the difference between panic disorder versus panic attack?
The frequency of attacks.
One it's chronic, one it's acute, just like
Perfect.
sudden.
Okay. So one is chronic, and one is acute. Which one is chronic?
The panic disorder, it's chronic, and panic attack, it's sudden.
Okay, how are you going to treat with a pharmacological option for panic disorder?
SSRIs.
So that since it's
SSRI.
acute, we can use
SSRIs, right? So for panic attack,
benzos. We can use benzos for the attack.
yeah, benzos would be the
Yeah,
right.
we can use
answer.
Ativan
But also beta
and
blockers.
propanolol.
Sure, that could also work.
Beta blocker.
The thing is that the board doesn't really like a lot of benzos as the answer. Like something like Atarax would be a good option, right? Atarax hits hard and fast, but it's not addictive. But it would not be wrong to say benzos either, right? But there is always the fine line between possible addiction and benefits, pros and cons. But the real world questions would be benzos. When choosing the benzos, you want to go for something that's long acting and hit also fast. Like diazepam would be a great choice. So today, this morning for me, somebody put a similar question, and the person was very frustrated with the answer from another board prep, right? So what I'm trying to say is that sometimes by you guys exploring other things, you are actually doing more harm than good. What you need to pass the board is in a program. The question banks are on point. It will be very, very similar. If you start exploring out, it'll create more confusion. And this was one of the questions that I saw this morning that was very confusing to the person, right? Had 4 choices of 4 benzos in it. It was the answer. And the question asked which one was the longest, but also longest half-life, but also the quickest to work. Combination of both, right? These types of questions are not questions that you would see on the board. Okay, these are more advanced questions. So when she's exploring other board preps, she's going backwards rather than going forward. That's just my take. Take it for what's worth it. If you don't agree, go ahead and do it. Okay, but be careful because your time is limited and how you spend it matters. That's my 2 cents on that.
So let me get this straight. For the boards, if it
One
says
second,
panic
one second.
attack,
One second.
and
We'll go back. Man, we'll go back in a second because I can't stop the question.
okay.
Okay, well done. Let me share this question so you know exactly what I'm talking about. Let me start sharing the Kahoot for a second, and let me share our Facebook group. So this is the question that I encountered this morning, right? Can you guys read it? Let me read it for you. An NP is managing an adult patient who has acute panic disorder. So that is panic attack. The NP is prescribing selective serotonin reuptake inhibitor for long-term pharmacological therapy, right? But is considering a benzo for short-term symptoms relief. Which of the following benzo is known for being absorbed rapidly and long-acting? So it would be a two-pronged answer. You want something that's fast but lasts longer, right? This would be a kind of a complicated question.
It is. It is.
It is, right?
It is.
So if you say long-acting,
That's it.
right? So, but even though she got it incorrect, the answer wasn't matching or something like that. But I mean, questions like that is gonna drive you crazy, and it's not beneficial to you because one, it's not high yield. This is more of an advanced question, and two, it's just taking your time away, right? So there'll be like tens of people here giving a comment. This is my comment on this question, so you kind of have my rationale, understanding of it. One second, let me just put it here for you, and you can read what I said. So you have you can see it now, right? So basically, if you really want to answer this question right, you got to look for the two things that the question is asking. Which one has longer a half-life, but also hits hard to start working right away? So the obvious answer would be diazepam. Is known for its rapid absorption due to its lipophilic or fatty, right? Actions leading to a quicker onset of action, but it also has a longer half-life, making it long-acting. But questions like this would not be on your board, I promise you. So the question is why someone would prefer to almost waste. I wouldn't say it's a waste of time because there is a lot of good components here for real life, but it's just not high yield for the board. If the goal is to pass the board, this is a waste of time. Now, if the goal is to actually learn and for real practice, this is a good question, right? So there is the difference between what is your intent. Is your intent to be really good at answering complex questions that's not going to be on the board, or is your intent to pass the board at this time, right? This is a good question for real life, just not a good question for the board. So be careful how you spend your time, I would say, because if your intent is to pass the board, then you need to be on high yield content that will help you. Think of it as the bigger box. I'm not gonna say names out there. They have books that are thick. There is
Hey boy, how are you?
There are tons of good analogies and acronyms. But if you are going to study for 50 different types of herbs, then you're studying for everything. Then therefore, nothing is important, because if everything is important, nothing is important, right? So there's tons of courses out there that are very good. They're just not very good for the board because they're giving you everything you learned in the past 2 years, and that becomes unmanageable, right? Meline?
Yes, hi, Dr. Lopez. So for the purpose of the boards, can you hear me? Yeah. For the purpose of the boards, if you had a choice where, let's say, a patient comes with panic attacks, not a panic disorder, but panic attacks, and you have an answer that's a benzo or an answer that's a beta blocker, would you go with the benzo?
It's hard. That's when it's hard, because in real life, yes. But I know that the board doesn't really love benzos. So it is a hard question. You know, it's likely the right answer is a benzo, but the board often prefers, and they should not give you that option, right? Because real life it would be a benzo. I would go for an Atarax, maybe 75 milligrams, maybe 50 milligrams, and then wait another 30 minutes and give another 50, depending on the person's size and all kinds of things. That would be a good option. It will be a compromise between a benzo and propranolol, right? Because propranolol works. It's going to drop your blood pressure. It's going to work, but it's going to drop your blood pressure. But it's not going to work as fast as the Atarax and have less effect on your blood pressure. So propranolol is good if you are going to give a presentation, you're feeling too anxious about it, social disorders. But for a panic attack, I need something faster, but not as fast as a benzo. Does it answer your question?
Yes, thank you so much.
Yes. So yeah, now I just want to give you my updates on this. You take it for what it is. If you feel that I still want to take their board for passing the board, go ahead and do it. No problems. Okay. But I'm just telling you, if you're going to study everything and you're going to be so in depth and the content is going to be so huge, then it's likely that you will not pass because it's too much to manage. Okay. So we learned yesterday dialectical behavior therapy is good for borderline personality disorder. We learned who created is high yield and what is the goal. We need to know what is the goal.
Decrease
right?
suicidality.
Decrease crisis, decrease suicidality. Yes, absolutely right. These are high yield content. That alone could be 3 questions in different formats. Okay, so that is the rationale there. Okay, next question.
Good job, Sarah. Guys, you have a hot mic. You need to mute your mic. Are you guys struggling the red screen, orange screen? Background. Janet, your mic is hot.
We can't hear you, doctor.
All right. As I was saying, this is actually a difficult question. You know, as you can see, there was I think the first question that was a lot of splits, right? When we look at logotherapy, it really means primarily, excuse me, it search the meaning in the primary motivational force in humans beings. What motivates you, right? The will to meaning is considered more fundamental than the field or will in the pleasure, or even other core concepts. That's why it's a bit of a difficult answer, but it focuses on helping individual find the meaning and purpose in their lives. So write it down, logotherapy, and put that under humanistic, close to Carl Rogers in that sense, okay? Because it really also develop a sense of existential. What's the purpose of my existence? Okay, so it's a hard question for
Dr.
sure.
Lopez,
Yes.
Dr. Lopez, what is the difference between logotherapy and gestural therapy? Because both of them have something to do with existential concept of life, something like that.
Yes, they do. But Gestalt, it's more who developed Gestalt, I think was Fritz Perl. It's like back in the 1950s. It's a humanic or humanistic therapy that has a holistic approach on psychotherapy. Like the term Gestalt, it really means in Germany the whole or to form. Okay, so it's like holistic, more of everything, and the emphasis on how connected the mind, body, feels, and the environment instead of focusing on the past. Gestalt emphasize more of here now compared to existential logo, more of in the past and how we could reanalyze our life situations of the past and come to a agreement on the present. So just out more here and now. That's the point. Encouraging patients to become fully aware of their presence, existence, thoughts, and feeling. Does it help? If you look more of the logo, will be a little bit more the reasons of why I am here, while just now is more the here now. What can we do going forward? Okay, so Gestalt also uses kind of like some some paradoxical intention. It also do sarcastic dialoguing, meaning if you ask me a question, instead of answering the question, I'll ask you a question instead. It does a lot of this for self-reflection. Okay. Not super high yield for the board. Yeah, not super high yield, but I would look it up a little bit more on logotherapy, just so for your awareness, you know, because logotherapy, as I mentioned, has a lot to do with the psychotherapy developed by Australian psychiatrist. It's more towards the Holocaust survivors with Viktor Frankl, and it's centered on human driven to find meanings in life and purpose. Okay. It's not super high yield. I wouldn't spend more than 5 minutes reading and just to get like a few concepts of it, whether it's here now, whether it's the past, and move on. Okay, don't spend times on these theoreticals frameworks that are not used a lot, and they will not be high yield on your test. You'll be lucky to get one question on this subject if. So if that's the case, then why really spend an hour, 2 hours and look at it again every other week? There is no purpose on that. Okay. So before we move on, I know there was somebody that had the question before and they couldn't stop. If you still have the question, please ask.
Oh, it was me. It was the Kahoot game. This is my first time playing. I joined late, but I figured it out.
Okay.
It's just, yeah, I know that you can't change your answers. Once
no, you can't change your answer. Once you press it, it's on. It gets better the more you practice. Okay. Thanks for being here.
Thank you.
All right, next question. Okay, for those that picked any one of the 12 that picked cognitive behavior therapy, what was your rationale for picking the answer? Anyone?
I just honestly didn't know what interpersonal therapy was.
Okay, that's a good answer. That's a good answer. Never pick something that you don't know because you never heard. I like that answer. But now we went over interpersonal therapy yesterday in details. For those that are in class, 24 of you guys, one of you guys give me why is interpersonal therapy better than cognitive behavior therapy? What's the key word that you found on the question? The bunch.
Family.
Relationship, family.
Relation.
It said conflicts.
Conflict,
right?
yeah.
Conflict.
Yes.
So yesterday we said, hey, let's say there is John and Mary. They're a couple and they are fighting. They are about to get divorced and they are arguing. Which of the following therapy would be the best choice? As a test maker, I would put it A, couples therapy. I would put interpersonal therapy as option D. Why is D would be the better option and the correct answer and not couples therapy?
Because there is no couples. therapy.
Well, I mean, it was John and Mary. They are married, so yeah, that is a couple. But the core of the
Yeah,
question,
because you have to look at yourself first, right?
yeah, is married to discord, interpersonal therapy. If couples therapy would be more towards, hey, let's see how we can better understand each other, so we can fulfill the love tank of each other here, right? If there is married to discord, interpersonal therapy is the answer. Most likely be the answer. Okay. So anytime, so for the person that said that you didn't know interpersonal therapy, anytime there is discord, conflict between two parties, interpersonal therapy is likely to be the answer. Okay. So thank you for saying your rationale. I like cognitive behavior therapy as the second choice. But if you're looking for the correct choice for the board, you got to look for keywords. And the keywords on this question was conflict. Okay. So you could also make the case by saying we want a cognitive behavior therapy because we want to change the irrational behavior or the assumptions that we have from each other that's causing the problem. It would be the correct rationale, but the question specifically had conflict in it, and that matches better with the interpersonal therapy as the type of therapy of choice. And that is a high yield question. You are likely to see interpersonal therapy on your test. You're very likely to see it. So if you got it wrong, or if you didn't know what it was, I would invest some time in learning interpersonal therapy. We covered this yesterday on our module 4. Okay. Next question. This is a hard question. All right. So as I would, well, most of you guys actually answer this question. Let me see here. Yeah, as I would assume, this is a hard question, right? So we didn't cover this because it's not super high yield, but the concept of homeostasis, right? In context of family therapy or family system theory, it refers to the tendency of the family system to resist changes and maintain its established patterns of behavior. So you don't want to change to the left or to the right. You want to, that terminology means stays the same for roles and interaction. And even if those patterns are dysfunctional, right? Is the family way of seeking stability and equilibrium. But why was this question hard, right? Because often of the name stasis often means
Equilibrium.
yeah. So be careful, right? That's why it was a hard question. Because
Right. You
that's what
have to know. You
yeah.
have to know the definition of this word.
Right, right. So it was a tricky question, right? So, but now, in family therapy concept, the homeostasis means no change. No, I don't care if it's good or bad or how dysfunctional things are. Is let's stay the same because changing is tough. Anytime you wants to change anytime anyone for any reasons wants to change, is because the pain of staying the same is bigger than the distress of changing. And I don't care what concept in your life you can use this. Let's say you are overweight and you'd like to have this fit body of 7% fat. Let's say that's your goal. You're only going to change when the pain of staying overweight is bigger than the action of doing it, what you need to do to accomplish your goal. And that's when changes happen, right? So homeostasis here is like no change, calm waters. That's what the meaning is for this family therapy. Okay. So here it's some of the, hopefully you guys can see, it says the tendency of a family to resist change and maintain familiar roles and dynamics even when they are dysfunctional.
Six 1-8-7102. 618.
Please mute your mic.
All right, so very good. So we learned a lot about family system therapy, strategic family therapy, solution focused therapy, what else? Strategic family therapy yesterday. So hopefully you did what I asked you. Pick up a white piece of paper, write down all those family therapy, write down 3 things about each one of them, and look at it every single day, because all of them starts with an S. It can be confusing, right? But if you do that for a couple of days in a row, you won't have a problem answering those questions, right? So family patterns of communication, roles, and interactions was the best answer choice for that question, okay? All right, so very good. So yesterday we covered family system therapy. Now, who created family system therapy is important. Who was that? Anyone?
What was the question?
Yolam.
Who? Oh, sorry.
Bowen.
Bowen, yes, Bowen. Who was the creator? So that's the first point. Second point is, give me the 3 characteristics or 2 of family system therapy that we covered yesterday.
Self-differentiation,
triangle, a genogram.
Perfect. That's all you need to know.
Right.
Family differentiation, self-differentiation, triangles, genogram. Is triangle good or bad?
It can be both.
It can be both.
Right? If the question asks what kind of a system is used to decrease stress, triangulation can be the answer. Get out of your head the triangle is bad. It depends how it's used. If the triangle, which is the connection between person A and B, is a 7 years old, obviously this is going to be bad. But in order to form a triangle, I am the third person that can be used to decrease the stress. It can be good. All right. Then we talked about self-differentiation. That is the core, and you need to know why and what that is. That means I am part of the family. I have mom and dad, and I'm part of the family. I'm the child, but I am my own person. I am part of this family. I connect with mom and dad. We are a family, but I still have my own personality, and I can be both part of the family and still be different, be my own thing, right? It is a core concept you need to know, okay? So the answer here requires each parent to maintain their emotional balance and autonomy. So how is it better than self-differentiation, right? Helps parents become more emotionally responsive. Sure. But if we go to the core of self-differentiation, right? Maintain their balance and autonomy. It is one of the principles where you can be part of the family, but you still be your own. You know, mom can be her own, dad can be her own, his own, and still maintain that self-differentiation, right? So here, for a more complete answer, so self-differentiation requires each parent to maintain their emotional balance and autonomy while engaging in open, non-reactive communication during their conflict. That would have been the full answer. Okay, so if the answer itself was tricky, but you understand the concept, then you're good. But remember, I'm not allowed to put more than few characters. Kahoot doesn't let me give you a full answer. So I have to make up an answer that is not complete. And this is a good example of that. The core here that you need to know is what is self-differentiation. If you got that, that is what matters. Okay. Okay, next question. All right, very good. Yeah, I do agree that the blue answer is pretty tempting, right? To improve parenting skills and communication. True, it's a good answer for almost all behavior problems like dysregulated mood for children, ODD, even conduct disorder. But here's for MST is more of a complex, bigger picture that addresses the systems and influences that are affecting negatively the child or adolescent, right? Here is what the complete answer looks like, right? Is a case where youth is involved in delinquent behavior such as substance abuse and conflict with the law. Multi-system family therapy is often considered the most appropriate intervention. MST targets the various systems that influence the youth behaviors, include family dynamics, peer relationships, school, and the community. So that is the multi-system that the question refers to, right? It is a comprehensive approach that addresses the complex factor contributed to delinquent behavior and provides strategy for change. And we addressed yesterday why, right? Because if we don't get a hold of them at this stage, it will be much harder when they become 18 years old and so forth. Okay? Okay, wow, I'm very, very surprised. You guys did really, really good. It's just because it's complicated answers here, right? Not that I'm surprised about your potential and what we learned yesterday. But between A and C here, it's pretty close, right? So I even see that many people pick the first option that says family members to share past successes and achievement, which almost is the same thing as saying envision the future where the problem have improved or doesn't exist. So when we look at solution, first thing you have to think is we're looking for solution that worked in the past so that help us in the present. So both of these answers do fit the explanation, right? But it's more of if we look in the future, do you remember a time that this problem did not exist? Right? So what kind of questions is that? Miracle question, exception question, scaling questions, right? If we look at the miracle question, so here is matching the solution with a miracle question without saying it is a miracle question, right? Is the key techniques using solution focused therapy. It encourages clients to imagine a future in which the problems have improved or been resolved. That is the answer. By doing so, it helps the clients get set goals and create a vision of positive changes. In a context of solution-focused therapy, this question can promote the family's members' engagement in the therapy process, right? So please remember, solution, we look for something in the past that worked, and we forward it to the present or future to almost give them a map to where to go to, right? So knowing the definition of miracle question is important. Any questions before we move on? Okay. Okay, so let's move on here. Good job, everyone. D was the better answer, right? Straightforward directives. Remember, example that I gave yesterday, I would like you to go home and buy a bouquet of flower to your wife every Friday, right? Compared to paradoxal, I would like you to go home, paradoxal directives, I would like you to go home and fight with your wife every Friday. Why we would ever say that? Well, if you know someone is very stubborn and will not follow the directions given, you almost want to reverse psychology, tell them to do something that is irrational and probably not good, so that they actually go around and do something that would be nice, just so that the because they don't want to follow directions, right? And straightforward and paradoxal directives falls under which category of family therapy? Strategic, right? Strategic family therapy. Please make sure that you're putting each one of those family therapies and putting 3 bullet points under each one, so you'll be able to look at it on the test day and kind of know exactly which family therapy it is referring to. Family therapy is high yield. Okay, it can be complicated, but it can be very easy if you take the time now to understand them. Okay, that is a denial, right? Okay, it's a common defense mechanism used to avoid facing distress or painful experience. In this scenario, the patient avoids of the discussions of their traumatic experiences and minimize the impact by suggesting a denial of reality of those experiences. The defense mechanism helps the individuals to protect themselves from emotional distress associated with the past trauma. Now, what is the reaction formation? Right? Involve expressing of the opposite of one's true feelings as a defense mechanism. This mechanism is not meant for most likely explanation for the patient's behaviors, as they are not expressing the opposite of the true feelings. Okay. Did anyone get confused whether the question was about the patient or the parents? Right. So this is something that we see on tests all the time. Sometimes the patient, the mother brings the patient, and people get confused whether the question is about the family, the mother, or the patient. So be careful when selecting your answer. Sometimes the answer will be true, but it's not true for the patient. It can be for the parents. That occurs a lot with that Alzheimer's, because the family is distressed, tired. But if the core of the question is ask what's best for the patient, and not necessarily for the parents or whoever's taking care of the patient, right? Sometimes it will be something like along the lines of the family is extremely tired and unable to take care of the patient. Therefore, it would be helpful to admit the patient. So that answer is mostly for the family, compared to due to safety reasons, an admission for the patient would be warranted at this time. So the answer is focused on the patient rather than on the family. Wow, very good, everyone. So active listening, providing emotional support for the patient during the therapy. When we say Watson, right, it's like it has a lot to do with nursing, health, environment, society, nursing, and really being about human caring as one of the main characteristics. Not very high yield for the board, but just want to throw that out there for you on this question format. All right, so let's take a look here on this question. You guys really did really well. What personal goals, aspirations would you like to work towards in your life? Would be the best answer, right? And that is the explanation. Remember of what we mentioned yesterday about the recovery model, that is never straightforward, and that we learned a lot by making mistakes, right? As long as we pick up and keep on going, then every time we become more, it becomes more astute, and we are able to overcome the problems in life. Okay, so let's see who's taking the podium today. All right, CK, good job. Jennifer Lopez, killing it. All right. And first place is good. Great name. And then we have Carl and Sarah. You guys did really good. Everyone did really good. Really, really good. So, you know, like if you want to know how well you're prepared, comparing yourself to others is the only way, right? So if you are scoring the top 10 out of those, how many people played today? I know we were up to 68 people at some point. Right now we got 55. So it really highlights that if you're in the top 10, and I don't remember how many people played today, you really are doing good, right? Just keep it at it. Don't stop. Don't stop a minute until you pass the board. You are able to really do this once and once only. No two-time test takers, right? If you already didn't pass the first time and you arrived to our program, that's okay. We'll start from now. So that being said, I just want to show this post here that was posted an hour ago by Rebecca Reed, right? And she went on to say great things about the program, but the truth is that she really put the work in it, right? She really was in the program. She came to the Kahoot. She came to the live classes, and this is the result that you will achieve if you do the same thing, if you do similar effort. So that being said, glad that everyone is here today and able to partake on these interactions. Any questions about anything that we covered or anything that's in your mind that you'd like me to discuss at this time?
Yeah, I wanted to comment on something. No, I know there are people who are the really fast readers and they are quick in picking up the questions. So do we consider the faster you get or the number of questions you answer correct as a benchmark?
The number of questions you answer correct is your personal goal, right?
Yeah.
It's your personal goal because you want to be correct. Now, I have had a handful of people, not with us, not our program, that came back and said, hey, I was only able to answer 140 questions, 150 questions. So the problem here is that a lot of people do question bank, but they don't do diagnostic tests. And they underestimate what it's like to finish 175 questions in 3.5 hours. And they're oftentimes not able to move on from one question. So Kahoot, it forces you to pick an answer within 1 minute, right? Instead of either you know or you don't. Because on the test date, you're only going to have a little bit more time than you have on Kahoot. You have 20 seconds more per question. So hopefully, Janet, that answers your question on why we set it for 1 minute. And for points, you get more points from being fast and being correct compared to only being correct as well.
Is there a way to get to know how many I got out of 40? Because it doesn't tell me the wrong answers.
Oh, I would have to go in a game and look at your score individually.
Oh, okay.
So I wouldn't necessarily know the answer right away. I would have to kind of like do some a deep diving. But it tells you your position compared to the group, I believe. Right? So all right. So let's see here. All right. So from yesterday, or any questions about the program, anyone has questions or anything that I can help you with? No? Okay. Yesterday we spent about 5 hours together. It was a lot. And today we touch base on some of the topics that we discussed yesterday, right? So if you feel that I'm going to answer all your emails now in the next hour. If you sent me an email yesterday, great. If you want to join the course, I put the link on the Google chat. I think all of you guys are in the course at this point, but if you're not, you're more than welcome to click and join. Next week, Friday, we are meeting for module 5, number 5, right? Ethics, culture, stuff about boredom nursing, right? Those are easy hanging fruit only if you have true knowledge on how to answer those questions. Otherwise, they can be a pain, right? We are going to go over laws in psychiatries and how they're applicable. We are going to go over the state board of nursing. We are going to go over some principles of charting and what we should say and how many release of information is needed for certain conditions, right? Once we master that, you'll be able to answer your questions with easy. But if you miss the class, you might be missing a good 10 to 15 points. And remember, some people are failing by 1 point. So don't rest on your laurels. If you are attending the live class, it's great. This is the most important test of your life, right? For you to move from where you are now to where you need to be, will need some work, right? And there is no magic bullet, but there is a shorter, easier, more compact way of doing it. So hopefully by now you really get it. If you have questions, let me know. My email, I'm going to put in a chat box, is pmhnp@npexamcoach.com. Okay? I'll be answering all your emails in the next hour. Other than that, this is all I have for today. We do have a question here. Aaron, kindly ask your question.
Yes, hi, Dr. Lopez. I was doing some of the questions, and I had all these complementary therapies, herbal medications, but I didn't see that on our module 4. But I got all these questions about vitamin E, yoga.
Yeah, great question. Great question. Why did you not see on module 4? Because it's not high yield. Okay. So you have two types of questions to bank. One that's super high yield and one that's broad. Just because it's not high yield, it doesn't mean you shouldn't at least have a knowledge of it. So I created a question bank that covers that. But if I'm going to cover every single topic for 50 different herbs, it's not going to be good for you. It's like me trying to compete with Fitzgerald or other big box company that are giving you everything, but it's not high yield, and a lot of people are failing. So what's important? That I covered good, what's important, and everything else I'll cover in a different type of question bank. So that way you are on the go, that you are achieving the highest possible yield for your time. Your time is the most important thing ever. So I gotta find a way to give you what you need without giving you 1,000 lectures, right? So,
yes. Okay.
All right. But thank you for asking. That's a great question, by the way. Dreamia, do you have a question there, my dear?
No, I didn't have a question. I just wanted to actually say thank you because, as some of you know, I posted that I passed the test this morning, and yes, and I just want to say that I took another board prep course before finding Dr. Lopez, and the difference in what I learned under Dr. Lopez was super amazing in comparison to the other board prep course. The thing I like about Dr. Lopez is he's very personable. He answers questions, even though you know he probably has a lot on his plate. He cares, and he does want to see you pass. So if you ask my opinion, the AANP, because I had to take them both since I did not pass the first time with the AANC, the AANP was a little bit easier. What I liked is you had the same amount of time as the AANC, but you had 25 less questions. and it was more direct. So if you ask me what my choice is, I would definitely go with the AANP. But if you listen to what Dr. Lopez says, reach out to anybody in the group. They love to do questions. They love to push you along. You're more than welcome to private message me because I want to see you succeed too. But this is where you should be for passing your boards because you will definitely do it.
Yeah, thank you. I really, really appreciate. I think you know, for the
Thank
past
you.
2 years, I really didn't focus at all on the company. As far I only focus on the students. I never ask people, oh, can you give a review? So a lot of people send me everyday emails me in passing rate, and that's great. But I need to start like, okay, we got to open up this for more people. So thank you when you come out and then you post your pass, and now we have people posting the pass on the Facebook, not only on our inner group. We have an inner group, like a small little gang, I call it, on the WhatsApp. All the passing rates are there, right? But they don't go necessarily out and put on Facebook and post the review. So, but now more people are doing it, and we can see more people joining the course and helping others. So I appreciate that a lot. So.
Yes, I appreciate you. Thank you so much for, being there, especially after I lost my father when I was studying after graduating, and just, helping me, telling me you were definitely in my corner. That meant a lot to me because a lot of people don't care. They just want their money, give you the material, and then you're on your own.
Yeah.
But you are definitely in the right place if you're here with Dr. Lopez.
Thank you. Thank you. Yeah, as I mentioned yesterday, once you are in it, you are in it. What do you mean? Like I'll be emailing you, I'll be asking you, and I'm not trying to be nosy. I promise you. All what I care is that you're doing okay, and life happens, right? Sometimes we have a divorce, family, health, and that's okay. We're not pressed for time. When the time is right for you, that's when the time is right for me. So we're not gonna be like, oh, your time expired, you have to pay more. No, this is not what I do, and will never be what I do. What I care is once you're in it, we're locked and let's go. Right?
Most
So,
definitely.
yeah. Well, I'm sorry again for what happened with your father, and thank you again, and congratulations for passing the board. I know this was definitely a challenging moment for you. As you mentioned, you didn't pass the first time. So I'm super happy and stoked to see that you achieved the results that you deserve. Welcome to the table. Yes.
Thank you.
Absolutely. The PMHNP BC table. You got a seat. Great.
That's good. Yes.
Okay.
Congrats.
Yes. So someone asked if will be more classes in Saturdays versus Friday. The answer is yes. So this is a kept secret. I'm moving back to the US. I am stationed right now in South Korea. I'm moving back to the US in June, so like maybe a month and a half, and there will be a switch in schedules, basically more live classes. It may not be necessarily Saturday, but throughout the week, instead of covering one module per week, we may be covering two. We'll have a summary coming up of 2 days, high yield content for the board. So if you are in the course, is already part of your curriculum. So for 2 days in a row, Saturday and Sunday, I think not this weekend, but the following weekend, we spend 2 days back to back to ensure those that are testing that week are good to go. Lots of questions all day long. I'm taking off work so I can be there the whole day for you for 7-8 hours, 2 days in a row. It is part of your schedule. A lot of people ask, what is the schedule? Email me. I'll be sending it to you in a minute or so once this meeting is done. Yeah, so super stoked that you guys are here. Anyone has any question about anything whatsoever?
Yes, Dr. Lopez.
Hi.
Hi, this is Pam.
Hey,
So
Pam.
I was wondering, is that May 10th, that weekend where you'll be going 2 days? It's 2 weeks from now.
Yeah, I think it will be.
Yeah, okay.
I have to look at my schedule, Pam.
Okay.
My wife is the one who does the schedule for me, so I have no idea. I only know that this weekend this Friday will be module
Module
5, and then
Module
following
5.
weekend will be the crash course review. But we're gonna divide, instead of giving you 8 hours class, we're gonna divide it in 2 days, maybe 6 and 6 or 5 and 5, whatever it takes for the day that everyone leaves out of there very confident.
Okay, great. Thank you.
Absolutely.
that.
Yeah.
All right, thank you.
Absolutely, my pleasure. So, yeah, so please send me all the communication. You have to send me an email. I see someone ask for the schedule. Please send an email so they can respond to you with the schedule for next week. PMHNP at ANCC Exam Coach. Exam coach.com is my email. So that way, please send me an email, Annabelle, because that way people, they'll have people that are responding to you. Please send me an email. Okay. All right, guys, this is it for today. We covered a lot yesterday. Download your PDF, and your job for this week is really preparing for next week class, but also revisit what we learned from module 4, 3, 2, and 1. And then when we arrive to module 6, which is a crash course review, you are on point. Okay. Queen, you have a question there?
It's me. I just want to ask you, for the diagnostic test, may I took them many times, or it has to be before the exam?
So you take one once you first come to the program. This will set the tone where you are. Now you're gonna take another one on module 7, and you take the last one on module 8. The module 8 is your diagnostic test number 2. You should take that 10 days before your test date, because you will have time to adjust if you have a low score and still test that out. But if you're taking that test 1 day before your board, I'm sorry, there is no more time. Right. So it's kind of like I really need you guys to understand that. Oh, yesterday we had somebody testing the next day and taking the diagnostic test the day before. Now it's really, really hard for me to coach you and help you navigate within 24 hours if you need assistance. So you have to put that on your schedule 10 days before the board. You need to be done. So that way I can look at your test and suggest maybe some improvement, and we still have 10 days to go. Everybody clear on that? Okay. If it's last minute, it's very hard for me to help you.
Right. So I took it the first time when I first start, before I even review the module, I did it.
Okay.
So now I can just retake it again.
You will retake it again, the same test on module 7. Now it's going to show you how much you have learned.
Yeah, because I finished with all the module. I took all the question on the bank already. So I just need to see where I am, what I learned.
So now you should be doing module 8, which is the diagnostic test 2.
Okay. All right. Okay.
And then you should email me with any questions or any concerns or any stuck points that you still having before your test date.
Okay.
Okay.
All right. Thank you.
Absolutely. Ernon, could you
Yes,
please?
I was trying to figure out which one is module 7. Because
What do you mean? Which module 7 will be a diagnostic test number 1 again.
Okay.
Module 8 will be a different test.
Okay. All right.
Okay.
Thank you.
Thank you. Absolutely. My pleasure. Okay, everyone. Good luck if you're testing this week. If you need assistance, email me, PMHNP at PMHNP at ANCCExamcoach.com. All right. Before I go again, one more question. Queen, how can I help you? You're muted. Okay.
Hello.
Go ahead.
Good evening,
Yes, hi.
Dr. Lopez.
Good evening.
Yeah. This. I'm sorry, I wasn't really fully engaged in this because I'm at work. Are you gonna post this in the link?
This will be posted on our YouTube channel. Okay. So you go to YouTube and you do NP Exam Coach. This will be there in the next 24 hours. We got to clean it up, send for the video guy to reshape it, and be available.
At first, your voice was very low, though. I don't know
Okay.
what happened there.
So I'm sorry.
Yeah.
I don't know. Maybe I need a new mic. Yeah. Thanks for letting me know, though. Okay, just
All
go
right,
to
thank
YouTube
you.
and search it. npexamcoach.com. It will be there.
Okay, all right, thank you.
Okay, guys. Good
And
night.
again, yesterday we spent over like 6 hours model. Are they all gonna be in the model 10?
Yes. Yes.
All
They'll
the
all
hours
be.
we did, all the hours we did yesterday.
Yes. So it will be a recording version of Module 4 or Module 10. Module 9 is one-to-ones that I spent 5 hours with different students having one-to-ones. You guys should watch it. You should watch it because it will help you bring those questions from your mind, because I'm not teaching you, I'm asking you questions or asking the student questions. And instead of having one-to-ones with you for an hour, I have uploaded maybe 6 hours of conversations that I had with students in the past, this year, last year, all important information. That's on Module 9. Okay? All right, everyone. Good night. See you guys next Friday, 5 p.m. Eastern Standard Time. Questions? Email me. Okay, I guess another one. Makita, one last question before I go, please. Makita, you have a question?
I'm sorry,
Hi.
I didn't mean to push that.
That's
I didn't
okay.
mean to. We're all set.
All set then. Okay. If you guys still have a pending question, email me. Okay. Good night,
All right.
everyone. Thanks
Good
for
night.
being here.
Good night.
Bye bye.